I do not have the translator's notification.
Can you see it now?
Hello, everyone. We'll be with you in 1 minute.
Выберите, пожалуйста, язык, который вам удобен, русский или украинский. Спасибо.
Okay, so let's get started. Good morning, good afternoon, good evening. My name is Antonio Harden. I'm a child psychiatrist here at Stanford. As you all know, we've been working as part of the Stanford Autism Projects for Ukraine that has two components. The first one is webinars, and that's one of the activity that's included under the webinar series. And also we're having a toy drive. We will put the website in the chat room for people can identify the different activities. We've been doing webinars for the last, let's say, 6 weeks. We started on April 11th with a topic on trauma in use, stress and resilience. And on April 20th, we did one on psychopharmacological treatment of autism spectrum disorder. On April 25th, we did diagnosis of autism spectrum disorder. On May 4th, we did anxiety in autism spectrum disorder. Last week, it was pivotal response treatment in autism spectrum disorder. And I am excited today to introduce Devon White, who is the director of the ABA Early Intervention Program here at Stanford Children's Health. She will be talking about positive approaches to assessing and changing behavior in individuals with autism spectrum disorder. At the same time, we will have a translation in Russian and in Ukrainian. And the hope is that in the near future, we will have these translated presentation on our website so people can come back and listen to them, or you can forward them to friends and colleagues. Without further ado, Devon, you have the floor.
Thank you. Hi, so happy to be here this morning or evening. Thank you so much for welcoming me. And I'm excited to share with you some perspectives on positive approaches to treating behaviors in children with autism. Sorry, my slide is lagging. Okay, so let's really start with the basics in terms of what is a behavior. We have some more complex and advanced definitions of what a behavior is. The American Psychological Association describes behavior as an organism's activities in response to external or internal stimuli, including objectively observable activities, introspectively observable activities, and non-conscious processes. But what does that really mean? B.F. Skinner has a radical behaviors model that he created that really talks about this idea that there's a relationship between behavior and the environment. So every behavior has some type of impact on our environment. And the way that he looked at this through operant conditioning was to understand that in an environmental situation, we learn as humans to engage in a certain behavior, and that behavior results in a consequence for us. And if that is a good consequence that improves our situation or improves our environment, then we're likely to do it again in the future when we're in a similar circumstance. So it's really important to understand that all behavior is actually learned, and behaviors are things that we do to change or have an impact on our environment or circumstances. We often talk about this idea of challenging behavior in autism, right? Or interfering behavior or problem behavior. Historically, there's different ways to categorize behavior. And I really want to clarify the difference in symptoms of autism or neurobiological symptoms of autism and behaviors that are related to those symptoms so that we can have a clear discussion about how we can change behavior. Again, for me, conceptually, when I think about what is a challenging behavior, I think about any behavior that interferes with an individual's ability to learn. And so learning can be, learning academically, but also learning how to participate in meaningful social activities, learning how to make friends, learning how to communicate. All of those things are really important. So anything that interferes with that ability to learn can be challenging. In autism, we talk a lot about these deficits in communication, right? And the truth is a lot of the behaviors that we observe and see in children with autism have some type of relation to these deficits in communication. We also talk about this rigidity or insistence on sameness, which is common in autism, repetitive behavior, kind of obsessive compulsive behavior related to one topic or one activity. Sometimes we talk about impulsivity that we might see in autism, and we talk about ideas of sensory dysregulation. Now, it's important to remember that autism is individual and it looks really different, but these are some of the kind of symptoms that are often talked about that I can relate to specific behaviors that we might observe. So this is something that might feel familiar to many of us, but in this picture, this baby's crying, right? It could also kind of be conceptualized as a tantrum, especially in some individuals with communication deficits. And again, this is a behavior that we see, which is a result of a symptom, right? So these deficits in communication can encourage kids to learn specific behaviors. Here's another picture that might resonate with you. So this could be related to this behavior of lining cars up, could be related to this idea of rigidity or insistence on sameness or repetitive behavior or obsessive interest in a specific item. But this is what the behavior looks like, right? It's not the symptom, this is the behavior. Another example, maybe this child is very interested in spinning objects, and maybe she's more interested in the way she can get this toy to spin or look when she's playing outside rather than engaging with her peers successfully at recess. And here's an example of what a sensory dysregulation behavior could look like. So, children who might cover their ears in response to some type of sensory stimulus. So again, really thinking about what is observable and what we can see. I want to share with you a little bit of information about positive behavioral support, and we'll relate it to specific examples later. But there's a large body of research that talks about how to encourage positive behaviors, right? So when we first started studying behavior, punishment was something that was thought of as changing a behavior. So you see a kid engage in a behavior and you really don't like it, or it's really not safe, and so you punish them to make it go away. And in some respects, that can be effective, but it's probably not super enjoyable for the parent or for the child. And it's not the most ethical approach. So what we really want to be able to do is provide support for positive behaviors. Really focus on what do we want this child or individual to be able to do, rather than how do we get them to stop doing that, right? So some really important components of positive behavioral support are individualized interventions, right? So we know that if we can tailor an intervention to an individual, then outcomes are usually better. So thinking about family dynamics and thinking about resources and thinking about child strengths and making sure that all of our interventions are culturally relevant is really important when we're putting in time on the front end to create interventions that are going to be successful. My favorite thing about positive behavioral support is that it's a proactive strategy rather than a reactive strategy. It can be really hard as the adult to remember how to react in the moment when you are trying to change a challenging behavior. And if it's hard for us, it's 10 million times harder for the child who's engaging in that behavior, right? But if we can find ways to be proactive in encouraging positive behavior, then we often are able to be more successful. So priming or expectation setting is one type of tool that we might be able to use to help a child know what to expect and to encourage positive behavior. For kids who are more verbal, we can just tell them what's going to happen and what to expect. For other kids, maybe watching videos or looking at pictures can be more helpful in terms of priming or expectation setting. There's another fancy technical term called a high probability request sequence, but that basically just means really having a child do a lot of easy things that they know how to do, that they're really good at, before you ask them to do something hard. And that can really help with motivation. Also, in kind of less stressful situations or kind of easier routines throughout the day, we can teach kids to be tolerant. So tolerance in terms of waiting for reinforcement or waiting for that thing that they really, really want, or tolerance in terms of flexibility during play routines, flexibility with transitions, flexibility with changes in schedule. These are all things we can practice to be proactive and to support positive behavior. We really want to consider child motivation. So thinking about how can I incorporate things that are interesting to this child to help with that buy-in. And we can arrange our materials and have things that are engaging and interesting to promote that motivation and attention, and also facilitate a lot of opportunities for communication. Again, when a child's able to communicate and we're able to react to them or reward them for that communication, it mitigates the need to engage in some of these other challenging behaviors. And then finally, this idea of a response interaction strategy. So really, a catchphrase that we use is catch them being good. So give a lot of positive attention and interaction when kids aren't engaging in challenging behavior. Sometimes we have big reactions and provide a lot of attention only when a child's doing something that we don't like. But if we can give a lot of positive feedback and interaction around positive behaviors, that again can help prevent the need or a circumstance for a child to engage in a challenging behavior. So focusing on interactions and reciprocity. Recasting is a great tool where if a child, gesturally points something out to you or shares something with you or says something, you just reiterate what they said and acknowledge that you're seeing what they're seeing and engage in that reciprocity with them. So these are blanket ideas, and we have to think about when to use these principles or these protocols and how for each specific child and each specific behavior. And for me, something that's really important in clinical practice is deciding when to intervene, because sometimes individuals with autism can engage in kind of like non-traditional behavior, but it doesn't necessarily warrant an intervention, right? So we really have to consider this idea of risk versus benefit when thinking about changing a behavior. So, if we've tried these proactive strategies, or maybe this child has really learned how to engage in this behavior to get the outcome that he or she wants, and we have to intervene, we can't use those proactive approaches as easily. We want to be really thoughtful about our rationale for intervention. So something that I learned earlier in my career and that really sticks with me is this idea of how to prioritize what behaviors to target for intervention. So the first and foremost is my child's engagement in this behavior posing a risk to his or her safety? And those are the behaviors that we really want to focus on for intervention, right? So, you know, if a child climbs on tables, that could even be in a preschool, a dangerous behavior, or certainly self-injurious behavior, right? These are the top tier behaviors that we want to intervene and kind of focus on. And then we want to think about dignity. So for me, when I think about dignity, communication and advocacy is pretty high up there. Taking a developmental perspective or an individualized approach, we want people to be able to communicate their needs and their wants, right? So it's really important that we change behaviors that might compromise dignity. So again, you know, teaching kids to communicate, but also things that foster independence, like toileting and toilet training, and some of those self-care routines, or kids who tend to be kind of passive and let other peers take their toys. To me, that is related to dignity, right? So we want to make sure that we're teaching behaviors that improve overall quality of life and dignity. And then the one we really get stuck in is this idea of social validity. And I would say, yes, socially valid behaviors are important, but they're not more important than dignity or safety. So, you know, teaching kids to be socially appropriate, this is where we see some of those interventions related to stereotypy or, you know, changing repetitive play or hand flapping or things like that, which certainly can impede a child's ability to interact with peers or with the environment. But really kind of framing your priority and your rationale for changing behavior is very, very important. So once we've created a rationale and really decided that this is an important behavior to change, and also acknowledge that we need to create some type of intervention because positive proactive strategies are not enough right now, we can go through some specific steps to changing behavior. So the first one is defining the behavior. Then we're going to collect baseline data, understand the behavior's function, which we'll spend some time talking about. And then we'll choose a functional replacement behavior. We'll create a system for prompting and reinforcing that desired replacement behavior, and we'll monitor progress. So let's kind of walk through these steps generally, and then we'll apply them to some specific cases. When we talk about defining behavior, it's really important to have a definition that is unchanging and understandable to everybody who has a stake in changing the behavior, right? So again, we have to acknowledge that changing behavior or implementing these interventions is often difficult. And we have our own emotional responses and biases when children are engaging in challenging behavior. So creating operational definitions is really important in keeping everybody on the same page and understanding what constitutes a behavior and what is not an example of behavior. What does that behavior look like? Again, not what do we feel it is or what we feel is contributing to that behavior, but what are we actually seeing and observing when we're talking about this behavior? We really want behaviors to be measurable, so we want to be able to understand, you know, when it starts and when it ends, rather than using more general terms like, oh, she cries all the time, or oh yeah, she throws her toys when she's angry. We want them to be observable again, so things that are actually happening that we can see with the human eye, and not talking about feelings and internal states. That's not to say that feelings and internal states aren't important, but they don't help us in being able to track and measure and change behavior. And then we really want to make sure we have a repeatable or technological definition, which just means that every person who is observing this behavior or taking part in this intervention has the same understanding and definition of what that behavior is. There's this kind of silly analogy, but it can be helpful in terms of trying to understand what is a behavior that we can target and what is not a behavior, right? So generally, if a ball of string can do it, then it's not a behavior. So can a ball of string not participate in social activities or not complete its homework? Yeah, it's not a behavior, right? A behavior has to be something that a living thing or person can do. So can a ball of string share toys with peers during play activities, or complete 3 math problems on a math worksheet? That's an observable, trackable behavior. I think a lot about this, you know, we tend to have this, I don't know, temptation or tendency to focus on what we don't want kids to do. And I try really hard in my clinical practice to put myself in the position of the kids that I work with. And I think about, you know, if I went to work every day and my boss just followed me around and told me what I can't do. Don't do that. No, you can't do that. No, we're not doing that. No, it's not time for that. No, we can't have this right now. I probably wouldn't enjoy my job very much. And I'd probably feel really angry and sad and not motivated and not really want to participate, right? But when we can provide kids with actual alternatives or options for things that they can do, then we can help guide them in alternative choices and behaviors. So really, again, kind of silly, but I think very important to remember that we're not talking about what a child can't do or won't do or doesn't do, but what we want to be able to encourage them to do. The next step kind of procedurally is collecting baseline data. So we won't spend too much time on data collection today, but we do want to understand how often the behavior is happening before we intervene. And baseline data is really important because it's the only way that we can understand whether or not our intervention is effective. So just, you know, especially in a parenting situation, trying to get a general sense of how often this is happening. So you can just simply, you know, count how many times in the day the behavior happens. You can track the duration. So for example, if you're talking about sleep training, maybe recording how long the child cries before they fall asleep at night. Or rate could be, you know, how many times in the math period at school does this child disrupt the classroom? And again, this is important in helping us evaluate whether or not our intervention is effective and if we're making progress. So here's an example of what baseline data can look like. In this example, you know, we're looking at this behavior of disrupting the class by shouting out. So how many times during math period does this student shout out before we've come up with an intervention? Okay, now this is one of my favorite parts, is before we've gotten an idea of how often the behavior is happening, we've defined the behavior and we've thought of a rationale for intervention. And the next thing that we need to do is understand why it's happening. We can't change behavior if we don't know why it's happening, right? We can't teach something that is meaningful in terms of a replacement behavior if we don't understand the purpose of the current challenging behavior. So we want to understand under what circumstances does this behavior occur? You know, what happens right before? What happens after? Who's around? All of these things are really important in terms of gaining information about why a behavior is occurring. Something that we can do is what we call collecting ABC data. And this can be as simple as keeping a piece of paper in a notebook and just jotting down, you know, what was happening before the child engaged in the behavior. Like I said, who's around, maybe what time of day, during what activity. Was it like right when it was time for bath time or right when it was time for math class, right? And then understanding what the behavior looked like. What did the child do? What did he say, right? And then what happened after? What did you do as the adult in the situation? Or what did other people in the situation do? How did the situation change for the child when he or she engaged in that behavior? And by collecting this data, we can start to understand the function of the behavior. So what purpose does it serve? We can do this through direct observation. We can do it ourselves. Or we can interview relevant stakeholders. So we can interview parents, we can interview teachers or babysitters, We can also interview the individual directly. Wouldn't it be nice if we could always do that? It's not always the case, but that's another option for maybe adults or children who are more verbal to kind of get their perspective on their environment and how their behavior served them. And again, remember, a behavior only continues if it serves a positive consequence for that individual. So we should see some type of pattern in the environmental setting before and the consequence that the behavior resulted in. And this is something that has always fascinated me and still does to this day, but every behavior that we engage in serves one of 4 functions. So every person, anything you do in the day is because of one of these 4 reasons, right? So the acronym that we use is SEAT, S-E-A-T. So sometimes we do things for sensory reasons, right? To kind of gain a sensory feedback or sensory stimulation, or even to escape or avoid a negative sensory experience, right? So taking ibuprofen or Advil when you have a headache is actually an example of a sensory maintained behavior because it relieves you of pain. Or biting your nails or twirling your hair could all be sensory maintained behaviors. We might engage in a behavior for the purpose of escaping a situation that we don't want to be in, or avoiding a situation. So procrastinating, ultimately we do have to engage in that behavior that we're avoiding, but we buy ourselves some time. And so it's important to think about escape and avoidance. We might engage in behaviors for attention from other people, picking up the phone and calling someone. Or we might engage in a behavior for tangibles, right? So we go to work and we make money so that we can buy things, or go to the grocery store so that you can get food. All of our behaviors are maintained by one or more of these 4 functions. So our goal after collecting the baseline data and identifying the behavior is to figure out what category the behavior fits into. So let's go through some examples of specific kids. You remember this picture? This is Derek, okay? So Derek holds his ears when his peers are talking on the rug, and this behavior provides automatic sensory stimulation, right? Because it reduces this loud noise for Derek. So he's learned that whenever he's overstimulated or things are feeling too loud, he can cover his ears and maybe, rock back and forth, and he can avoid that negative sensory stimulation. Thinking about escape or avoidance. This is John. John loves going to the playground with his father after school. When he tells him it's time to leave, John falls to the ground and he cries. And then John's dad is trying to convince him to leave the park and walk home or get in the car. But when other parents or adults around start staring and looking, his dad decides it's not worth it. Okay, we can stay at the park for a few more minutes, right? So John has ultimately avoided and temporarily escaped this situation of going back home and leaving the park. An example of a behavior that could be related to attention is a little girl who screams every time her parent leaves, right? So if the parent leaves the area, she starts screaming. And then the parent runs back to the living room to try to play with her again and says, oh, what's wrong? And so now she's learned that if she wants attention, she just has to scream. And so every time she wants attention from any adult, she's started to scream. And here's one more example in terms of access to tangibles. So Marisol is a little girl who really loves the color red, and she loves building with blocks. And at her play program, every time a child builds a tower, Marisol will go over and crash it down. And when the tower crashes, her peers get really upset, and Marisol collects all the red blocks, and she's able to then go play by herself. So hopefully this is a clarification of the different functions that these behaviors could serve. There's a lot to do before we can change a behavior. So we've discussed the rationale, the definition, the baseline data, the function, and now we have to identify a functional replacement behavior. So again, this goes back to when I was talking about, going to work and your boss always saying no to you. We want to provide some type of behavior that a child can engage in instead of the challenging behavior. So here's an example again of Marisol on that challenging behavior. And identifying a functional replacement behavior is really important for a few reasons. So first, we talked about how, giving a child a choice of what they can do is helpful in and of itself. But for us as the adults or the interventionists, it's really important to identify the behavior that we're going to reinforce, right? So if we're not going to reinforce the child when they crash the blocks down, what are we going to reinforce her for? And that will help us stay contingent and really make sure that we're only providing that reward or positive outcome when the child engages in some type of functional replacement behavior. When we're thinking about functional replacement behaviors, first and foremost, we want to make sure that it's safe and it's reasonable. So we want to make sure that we're identifying a replacement behavior that's attainable and easy enough and kind of at a skill and developmental level that's appropriate for the child. We want to make sure that the behavior we're choosing is socially valid and acceptable. And this is really important because we won't always be there in circumstances when the child has kind of a choice to engage in the challenging behavior or the replacement behavior, right? But if we can identify a functional replacement that is socially valid and acceptable, it increases the likelihood that the child is going to receive a positive outcome from other people when they choose to engage in that functional replacement behavior, right? Again, really important that it's functionally equivalent or serves the same purpose, right? Helps the child obtain the same outcome or fulfill the same need. And we're really in good shape if we can identify a functional behavior that actually requires less effort than a challenging behavior. So often thinking about tantrums are exhausting physically and emotionally, right? So if we can teach a child to just say one word or do one easy thing and reinforce that rather than engaging in this full-blown 20-minute tantrum, oftentimes over time, children will choose the less effortful response if it results in the same positive outcome. So choosing a behavior that's less effortful can be really important in actually facilitating change. Here's an example of what a functional replacement behavior could look like, right? So for Marisol, depending on her language level, one thing she could do is go and sit with her peer and say like, red block, right? Or maybe she has a lot of language and she is really specific or rigid in her ideas of how she wants this tower to be built, right? And when the peer is not able to build the tower in the way that Marisol wants it, she crashes it down so she can collect her blocks and do her own thing by herself and build the perfect tower. So we might be able to teach her to say something like, oh, I have an idea. Let's put the red triangle block on top. And then she might be able to not only access what she wants, which is her perfect tower and completing it, but maybe also positive attention from a peer and ultimately making a friend. So really wanting to conceptualize making this replacement behavior worth it for the child and the individual, because it's work to change our behavior. We talked a little bit about this ABC model way in the beginning, and I'm just going to kind of briefly run through some of the things we talked about related to positive behavioral intervention, but different ways that we might be able to prompt functional replacement behaviors. We can create cues, whether they're verbal cues from an adult or pictures to remind kids about that positive behavior. We can model, just saying or doing what we want the child to do. Provide a lot of feedback when the children or child is engaging in that any set of positive behaviors, right? A lot of attention and recognition, even for just sitting quietly and attending or engaging functionally with a peer. Providing choices is always super, super helpful. So, you know, John, it's time to go home. Do you want to have a snack or watch a show? Or saying, it's time for circle time. Do you want to sit in the red chair or the blue chair? Just giving a child some sense of choice or autonomy can make a really big difference. We also talked a little bit about expectation setting and priming. So explaining what's going to happen, explaining the behavior that you'd like the child to engage in, explaining the positive consequence of that behavior. Arranging the environment in a way that facilitates, you know, positive interactions as well. So it would be best case scenario to teach Marisol to ask her peer for the red blocks, but another alternative or a step in getting there could be to have, you know, the red and yellow blocks in one container and the blue and green blocks in another container, so that Marisol is able to take the ones that she likes and have a positive, at least parallel play or interaction without disrupting the other child. So thinking about how you can set the environment up ahead of time. And then also hugely important is communication replacement. So prompting language is great, but if kids aren't there yet, we can use pictures or use alternative communication systems or gestures to help provide some other way of communicating a need or a want. So you can choose any one of these or a combination of these strategies depending on the child and the circumstance and the behavior that you want to prompt. The child will then engage in the desired behavior, or maybe engage in some lower magnitude of the challenging behavior, or try to engage in the desired behavior. And then very importantly, if you want to promote this new behavior, we need to provide that equivalent or best case scenario, better consequence, right? So through practicing and changing this contingency or this ABC situation, we can teach a child a functional, appropriate alternative behavior that serves the same purpose and fulfills the same need as the challenging behavior that we're wanting to change. Really quickly, we'll look at what this might look like for these kids, right? So we talked about Derek and how he gets really overwhelmed because it's really loud at circle time, so he tends to cover his ears. So Derek's teacher decides to use a combination of priming and choice and lets him know before it's time to transition to this free play time in the day, and gives him choices about, oh, you can go play on the carpet with your friends, or you can read books in the quiet corner, right? And so then Derek chooses to find a quiet space proactively and finds an entertaining activity that's quiet and, you know, reasonably stimulating for him in that circumstance, and no longer has to experience that overwhelming noise, and at the same time doesn't have a need to engage in that behavior, right? So choosing something that serves the same function, and really importantly for the child or individual, gives the same outcome. We remember John, who has these tantrums when it's time to leave the park. So John's dad decides to pick some type of motivating activity for him to do after the park. That's one great strategy in terms of a consequence. He also chooses to give him warnings or some priming before it's time to go. And he's really smart to use environmental arrangements or those high probability behavior sequences. So John's dad has realized that he loves the swing. It's his favorite part of the park, and he's way less likely to transition to go home if he's on the swing when it's time to go. So before giving that 5-minute warning and explaining what's going to happen when they get home, John's dad helps transition him to the sandbox, or, you know, playing with a ball on the grass or something. So something that's less valuable and easier to leave for John. John is then able to transition and walk to the car from the park, absent of that tantrum behavior. And then when they get in the car, he gets a lot of praise and he gets to have his favorite snack while they're on the way home. So again, everybody wins, right? They're able to go home on time for dinner, and John's able to leave the activity without feeling really overwhelmed or upset by it, and access positive reinforcement engagement in another positive activity, in this case, having the snack. Remember Sarah, who has learned to scream when she wants attention from adults. So this is a communication intervention where her dad has decided to model and prompt for her to say, "Dad, come back." So as soon as he starts to walk away, he might hear her, start to get a little fussy or whiny or see her looking around. And then he'll prompt her to say, "Dad, come back." And then Sarah says, "Dad, come back." And he returns and provides a lot of attention and play. So that's an idea about functional communication for getting attention. And then finally, you remember Marisol. So a lot of social emotional training and prompting and learning about how to express preferences will allow Marisol to approach her friend and say, "Oh, can I put the red block on top?" And then, the peer hopefully will be flexible and allow her to do that. And then she gains access to the red blocks, which are her favorite things, and gets to complete the project in the way that she really wants to, right? So same function, different behavior. Once you have started to implement your intervention, it's really important to monitor progress, right? So it's very important to know that sometimes things get worse before they get better. You always want to account for safety, of course, but suddenly when a behavior doesn't work, we have the tendency to escalate and try a little bit harder until we've really learned that it's not effective anymore. So prompting that functional behavior can be really, really, really important in those beginning stages. But overall, when you implement your intervention over time, you should see a decrease or change in the behavior. So here's an example of that baseline data we looked at earlier. And in this case, the teacher has decided to provide a lot of positive praise to the student before he can interrupt or disrupt during class. And we can see that it seems to be making a difference, right? So on average, his interruptions are around 3 or 4 times a class compared to 7 or 8. It's a significant change. It's very important to also acknowledge that if you don't see change, we have to reevaluate our intervention. So really making sure that we got the function right the first time and changing and tweaking our intervention to make sure that it's actually effective in facilitating this behavior change. Oops, it was supposed to be like this, like a surprise. Some tips for success, kind of just from the field. Pick your battles, right? You cannot change all behavior at the same time. It would be way too exhausting as a parent or as a clinician. So really think about that pyramid and your rationale for changing behavior. It's much better to kind of systematically change behaviors than to try to do everything at once and execute it in a way that's not consistent. And if we find, the top priority behavior, and we teach a lot of great functional replacement behaviors, sometimes we see other challenging behaviors go away as well. You could imagine how valuable communication could be, for a milieu of challenging behaviors. Oops. Incorporate child strengths and preferences, right? That's always just going to make things easier for you. Making sure that their favorite color or their favorite item or, something really great is available when they try to engage in that functional alternative behavior. Reinforcing a child's attempts to engage in the replacement behavior. It won't be perfect the first time. Changing behavior is hard. If any of us have ever tried to change our habits or, change our eating habits or exercise or our sleep, it's difficult. So we want to be empathetic and make sure that as kids are trying and putting in the effort to choose the functional replacement behavior, that we're rewarding those attempts. Really stay consistent. So make sure that you stick with your intervention plan to help with confusion and to help to reinforce that alternative behavior very consistently. Over time, as a child is learning and choosing the functional replacement behavior, you can start to fade your prompts and kind of offer less assistance in remembering to choose that functional replacement behavior. Again, like I talked about earlier, it's the best if you can find something that's easier to do than the challenging behavior, catching them being good, right? So really make sure that you're taking a positive behavioral approach and providing a lot of child-specific or behavior-specific reinforcement for any positive behavior. Again, if the intervention's not effective, if things aren't changing, then make sure that you reevaluate the function of the behavior and that you got it right. That's everything for me this evening, and I'm happy to take time to answer any questions you might have.
Do you want to read the questions, Devon?
I can. I thought Antonio was going to, but let me check.
Okay, the first question. My son refuses to drink or eat liquid food by himself. Who is a spoon? He waits for me to feed him. Who is his spoon? If I don't feed him, he will get angry. If I make him hold the spoon and then place my hand on the top of his hand, he will do it for a short period of time, and then he will want me to feed him. Is there anything we can do about it?
Yeah, great question. I think there are a few things to consider. Sorry, I'm just rereading to make sure I have all the information right. So it's great that you've created this prompt where you're giving him some assistance, right, to help make that target behavior of feeding himself easier. You can think about slowly increasing the amount of time that he's eating by himself, and then feeding him the rest of the food. That would be one way to kind of reinforce his attempts at being independent. Another thing that I like to try is having him eat his very favorite liquids by himself. So if you're not concerned about nutrition, you can feed him all of the foods that you're worried about him ingesting for nutritional value. But if there's something he really loves, then maybe you require him to eat that by himself. So that would help with that motivation, right? It's the better consequence for the harder behavior, and trying to sequence that routine might help encourage his independence.
Next question. When my child is not feeling well physically, he has increase in repetitive behavior. He becomes aggressive, more monotropic, and refuses to do anything. I'm not sure what's mean monotropic.
Yeah, and then I think the second part is how to teach him to let adults know when his body's not okay.
Mm-hmm.
So this is, again, where you want to try to individualize your approach, right? It really depends on if the child is verbal or how he usually communicates. And I think it's really important that we acknowledge that in difficult times or situations, we have to change our expectations, right? So any of us, if we're not feeling good, we're not really our best. So you want to kind of think about what your expectations are in terms of his engagement in specific activities or his communication and how he's letting you know that he's not feeling well, and try to make it really, really easy for him. So again, depending on his level of communication, there could be some type of visual system that you use, and you can prompt and reinforce him to let you know by identifying a picture or just telling you, like, I don't feel good. And then the consequence would be providing him access to these lower effort leisure activities, right? Because if that's what he needs in that moment when he's not feeling well, then you could give him access to some of those sensory activities or repetitive activities that he might actually do really well with engaging in, rather than becoming aggressive.
Thank you so much. Okay, so I type you before in the chat, Evgeny Ponichensky. It's my alter ego translating Ukrainian questions or Russian question. My child picks up stones and cement on the streets, and then he puts it in the mouth. How can I change it? How can I help my child?
Yeah, good question. A lot of these are hard to answer specifically when we don't have an evaluation of the function. But again, I would think about what, based on the information I just shared, the important thing to do is understand the function of that behavior, right? So it's one situation if a child picks up things and puts them in the mouth, and then the adult runs to them and has a big reaction, right? Because you're worried about their safety. In that scenario, the child might have learned that that's an effective way to get adult attention, right? So your intervention in that scenario, if it's maintained by attention, is to give the child something else to do to get your attention. But if it's the child's way of exploring or playing, then you might have to find other ways for the child to engage with the environment, like, teaching them what they can do with the rocks could be a good option, like throwing rocks in water, or I don't know, all the different things that we do with rocks in our early intervention program, or just working on those functional play skills with some type of sensory aspect as replacement behaviors for putting the rocks in the mouth. But again, you can only identify what's going to be a good functional replacement behavior if you know why the behavior is happening, right?
Yes, thank you so much. Okay, next questions. And once you answered the question, I put it answer alive and done. So I remove it from the Q&A session.
Thank you.
Like a structure. My daughter is 6 years. She has autism and she's afraid to enter a new building. She is visiting different supermarkets without any problems. But when we visit some offices, school, friends, she's screaming and tries to run away. I try to tell her before that we will go to somewhere to prepare her, but she starts screaming just when we start talking about it. Also, she understands that I'm asking her not to scream, and she starts screaming just if I didn't give her what she wants, phone, chocolate. Not crying, but screaming as loud as she can. Thank you for your work.
Yeah, thank you for this example. This could be, again, I'm not there and I don't know the child, but this could be an example of how sometimes a behavior starts with one function, right? Like, for example, entering the buildings, maybe the screaming is effective in escaping or avoiding a situation. And then it becomes what we call dually maintained or multiply maintained by another function. So maybe she's also learned to scream when she wants something, right? When she doesn't want something and when she wants something. So kind of overall, again, thinking about the function and what behavior she could engage in instead is really important. It sounds to me like communication training could be really, really valuable in terms of, having her ask for the things that she wants. The other thing is going to be related to tolerating when she can't have what she wants. So I would try to start small. This is a big, complex behavioral situation. So you want to start with one aspect of the behavior and what you think is manageable. And that could just be communication training. Also, what can be really helpful is when you can't give a child something that they want, the really important thing is to be contingent. Like, it doesn't matter if she starts to scream louder and louder. It's really important that she doesn't get that thing. And to make it easier for her and easier for you, choose what she can do or have, right? So instead of just saying like, you can't, I'm sorry, you can't, and then ultimately giving in, you just try to stay really neutral and be supportive in providing the options that she can have. But of course, this is really important to think about, that it's difficult to implement some of these procedures when you're in public or when you have, social dynamics. For the entering new places, really tricky to kind of give you specific advice, again, because I don't know the child, but it sounds like you're doing everything right in terms of preparing her. And what would be helpful for her to learn is that the screaming is not effective, right? So think about the function of the screaming. Think about what happens when she screams in these different scenarios, and really importantly, identify what she can do instead that you can try to prompt and teach her.
Thank you so much. Okay, next question. Boy, 9 years old, high intellectual abilities. In connection with forced relocation due to the war, the following behavior appeared: smearing poop on the furniture, understands, realizes, but does say that he can control it, clean up himself, sensory reach. There are necessary tools. What would you advise?
Yeah, that's a really hard one. I think you have to, in these situations, again, especially when it comes to safety, really evaluate that there's no medical underlying factors or no, additional diagnostic factors. But also, again, it's all about trying to understand why that behavior is happening. I don't know if you've had any success in asking him, why he's doing that and why he's choosing to do that. Maybe there's something about the bathroom or the new environment that's aversive to him, right? So kind of understanding the underlying factors that offset that behavior, the circumstances, and understanding, again, what the consequence is, because sometimes it can be really tricky and I'm not saying this is the case for your son, because I don't know, but if a child is expressing that this is a sensory need, but it could also have some type of, attention function, or maybe he's avoiding, going to the next activity in his day. So again, really evaluating this ABC situation. I would start with collecting some ABC data and thinking about if you can identify, the true function of that behavior, then choosing the alternate replacement behavior and finding a way to make that more valuable than the behavior that he's currently engaging in, valuable for the child, right?
Thank you so much. Next question. One more question. Is there a possibility to take my daughter from a tablet with the movies without her screen? Thank you. It's the same parent who was asking before about child who screams every time when they go to any public places.
Okay.
Screaming
Yeah.
child.
I think you could try using the tablet as a reinforcer, because it sounds like that's something that's really, really motivating to her. So kind of depending on your circumstance, if that's something that's very rewarding, then you could make that kind of part of your routine of going new places. Maybe she could use her tablet while she's in the reception area, or she could have her tablet after a quick visit to an office of some sort. And then the strategies that we talked about, similar to the little boy at the park, right? Like think about these different strategies in terms of giving her a high probability sequence of behaviors she can engage in, like having her do things that are easy and giving her warnings, or maybe, having her choose one more video. And then again, once you've set that rule or circumstance, really making sure that you're contingent and that you don't give in to the screaming.
Okay, thank you so much. Next question. Thanks a lot. Second question. When we're walking in the street, my kid can suddenly fall down and hang on my hands, and he doesn't want to walk. He doesn't want to walk. He's just hanging on my hands.
Okay. Again, I feel like I'm saying the same thing over, and I apologize, but it's really important to understand the function. This is a really, really interesting one. Like, think about where you're going, maybe, or how long you've been walking, or, it could be that he's just physically tired, the sensory maintained behavior. It could be that he doesn't want to go to the place that you're bringing him. It could be that he wants more of your physical attention and he wants to be held. But again, until we can really try to understand why, then we can't change the behavior, right? So the really important steps in any of these behaviors is understanding the why and choosing a behavior that results in the same consequence. We can't change the behavior until we've chosen a functionally equal behavior. So I would say really do some assessment about why it's happening so that you can identify an effective replacement behavior.
Next question. My boy is 3.8. He doesn't follow my instruction. Level of understanding is low. Question. How to teach him not run away on the street? How to teach him to come back home without screaming and falling down? Not to take things that don't belong to him. To ask permission. Thanks a lot.
Sure. Yeah, these are all tricky because they're also very social. So I think, again, looking at each of those behaviors individually and really understanding what the function is, because the function of not running to the street might be really different than the function of coming home without getting upset, right? The tantrums, which is probably also really different than taking things. So I think, again, really understanding why any of those things are happening by identifying what happens right before and what happens right after, and trying hard to focus on what's observable and not our perspectives or experiences, because especially as parents, we tend to project our own emotions, which is normal, on a situation, right? And sometimes that can take away from understanding the true function or pattern of a behavior. So like I advised at the end, pick one of these things, like the one that is highest priority, and try to understand what is the offset and what is the consequence and how you might be able to teach an appropriate or functional replacement behavior.
Thank you so much. Next question. How to, it's a question about distant learning. How can we help, it's a pretty broad question. How do we help a mother of autistic child with distant learning?
I think that there are some options, and Antonio, I don't know if you want to weigh in about what's available through the Stanford Autism Center in terms of consequences, or sorry, not consequences, content for online learning for parents.
Yeah, so what we're doing at this time is posting the webinars that we have available. My understanding also that Autism Speaks, they do have also content that could potentially be available. The issue is that whether it's available in Ukrainian or in Russian for people so they can review this material. So that's what we have right now. We are in discussions right now to allow people or to facilitate people from Ukraine to attend our conferences. Ironically, we started the discussion earlier this week about that, and we will definitely share the information about these conferences as they become available. At this time, we have one that's going to be happening in October, on October 15th. And people can make a decision based on the topics, whether that will be of interest to them or not.
Thank you so much. Okay, we have a next question. A child drinks household chemicals, shampoos, liquid soaps. Function of behavior is self-stimulation, non-verbal child. Does not understand spoken language. Is very difficult to find more valuable motivation. Interested for no more than 5 seconds. Like, I'm reading this question and I'm scared myself. Sorry.
Yeah, this is a safety concern, right? So sometimes in safety concerns, we have to focus on just how to avoid engagement in the challenging behavior. So I don't know what the environmental circumstances are, but definitely keeping those items out of reach and unavailable. Also, just depending on your resources, making sure that the things you do have that are accessible are non-toxic, because some kids do eat soap and drink shampoo, and it's a lot better if we know that they're, you know, not going to be harmed. Again, for some of these situations, I think really understanding if there's any underlying medical risk or additional diagnosis, and then understanding the function. I would double, triple check that the function is solely sensory stimulation, because sometimes when children do things that scare us in terms of their safety, they can get a big reaction, right? Or they can, avoid a situation. So certainly the first thing to rule out is safety and medical, and keep the child out of harm, but then also evaluating if one of these other functions could be adding to that tendency to engage in that behavior.
Thank you so much. Next question. In a case of family moved abroad and child is suddenly placed in different environment, child definitely will be frustrated. Do you recommend to teach child new language if he is limited in speech, native language? I think mother tongue, they mean native language. How can parent and specialist help a child to have less stress in this situation?
Yeah, great question. It's important whenever, generally speaking, whenever there's a change in environment or circumstance, and certainly, exponentially in crisis situations, to make sure that, we're creating things to facilitating the easiest, most familiar thing possible. So if the child has any amount of language in their mother tongue, then it's important to keep facilitating that language, especially if communication is already limited and they're experiencing stress and difficulty coping, then it's important to facilitate speaking in that language. I wouldn't worry too much about teaching a new unfamiliar language, because what's really important is focusing on maintaining that ability to communicate wants and needs, and think about in any way possible how to incorporate child interests or things that are familiar or enjoyable for a child in a new environment. So hopefully through that toy drive and some of these other resources, we're able to provide things that, provide familiarity or comfort or just child motivation and interest. But I would really focus on helping the child to maintain communication and establishing some motivating and familiar items or routines in the new environment.
Yeah, let me add here, I think something that we deal with on a regular basis in the Bay Area, in the San Francisco Bay Area, if we have a lot of families who speak more than one language at home. So the question that we get from parents, should I focus on one language, or it's okay if I expose them, my child with autism, with language difficulties, to Spanish in addition to English, or to Mandarin in addition to English? The common sense is what Devon said, is to try to focus on one language. However, for the record, we don't have evidence, scientific evidence, stating that if you expose them, you expose a child with autism with some challenges in their language abilities, if you expose them to two languages, both languages will be affected by this exposure. So we don't know, but common sense will say that it's better to focus on one language at a time and to facilitate the development of that language.
Yeah, and the context is so important, because I always tell families that I work with, because we don't have that scientific evidence, theoretically, if a child with autism is already more likely to be isolated, then it could be okay to expose them to the language that the family speaks at home and include them in that. I think in this circumstance, it depends on if we're talking about intervention and a child's in a new country, in a new situation, and we were trying to teach skills, should we throw in this new language and hold them to that language? It might be too soon, but certainly kind of maintaining whatever allows them to be independent and communicate, and whatever is valuable for communicating and participating in the new environment. So the context is super important too.
And also, when a child is displaced, they are dealing with multiple stressors, multiple changes in their environment. So theoretically, you want to minimize the changes, and introducing new language might not be ideal with all the stress that's associated with it. However, like Devon mentioned, if they are in a new environment, they want to try to fit in a little bit more and assimilate. And that's where it becomes a little bit challenging. One guide in terms of for parents dealing with something like this is to monitor a little bit and observe your child and their reaction. If you feel that are okay with learning a new language, whether it's Polish or Romanian, and if they are open to that and they are interested in it and it's not creating additional stress, then you should probably very easily support that and help them learn the new language. But once you see or you feel that this is added stress with more tantrums, more sleep disturbances, more difficulties with tolerating frustration, that's the child is telling you that this is too much for me, and maybe you need to back up at that time or back off.
Thank you so much. What kind of strategy do I need to use to help my child sleep independently? Child does not fall asleep independently.
Antonio, do you want to take this one?
Yeah, so ironically, I was trying to look at a date here. I was able to confirm Dr. Micah Mazurek, who is a psychologist who works with kids with sleep difficulties. And she will be giving a presentation sometimes in June. It might be June 8th. So we will be able to respond with more expertise to this answer. But in terms of for this question, so up to 80% of kids with autism, they do have sleep disturbances. So it's not, it's very common. And usually what we start by recommending is the same strategies that we use with typically developing children with regard to sleep hygiene. One is having a set time to go to bed and a set time to get out of bed. Second is minimizing distraction in the room. And here it's very hard to be specific because we try to stay away from providing specific recommendations with regard to specific kids, but these are sleep hygiene that we recommend to everyone. So maintaining a quiet environment, helping the child transition to bed progressively, avoiding any excitement or any activities that are too stimulating around bedtime. So these are basic things that will work with a lot of kids, not all the kids. Now, with regard to sleeping independently, what comes to mind is some behavioral rewards that sometimes you could use to optimize the transition, an independent transition to bed, in terms of rewarding the child for, brushing their teeth and transitioning to bed on their own. Sometimes kids want their parents to stay next to them while they are falling asleep. So what we usually recommend is kind of a progressive desensitization, which is basically you stay with the child for 15 minutes, you read to them, you develop that bedtime routine that's very critical, and progressively you help the kid transition to becoming more independent in this bedtime routine. For example, you could start by talking to them a little bit and then read to them. And then after you read to them, you stay next to them 5 minutes before you leave. And then progressively you start peeling one of these behaviors at a time. One option is to, for example, is to sit next to them while they are reading, and then sit next to them for 5 minutes after that, and then leave. So minimize your activities with them. So that's what we call like progressive desensitization, or stepwise approach to helping them become more independent. Hopefully that is helpful, but this is kind of the idea in terms of how we usually recommend for these situations.
Okay, I'm jumping on a Russian-speaking question from Ziana. because by her message I understand it's from Ukraine. Hello, how do I react on a child full neglection on everything? Whenever I ask him about something, he just say no and protest. So it's relocated child, autistic child, who reacts on every request no and protest.
I think it's, thank you.
It's on Russian, I'm just translated.
Thank you. So again, you know, really focusing on stress and acknowledging the role that stress plays. I would say probably trying not to ask too much and trying to minimize placing any types of even social demands or language demands, but really working on some of those reciprocal interaction skills that I talked about in that positive behavior slide. So a lot of observing, a lot of kind of presenting items that might be motivating and interesting and trying to facilitate some type of positive social interaction and build rapport and a relationship with the child before trying to ask them to do anything. So really encouraging that trust and social reciprocity. And as children start to become a little more socially engaged or offer signs that they're interested in something like smiling or looking at you, just really providing acknowledgement, like, yeah, this is really fun, or, oh yeah, this is a great toy. So focusing on encouraging a child to interact around the things that he or she enjoys and finds easy and predictable in any circumstance is the best way to start. And I think that's especially true in circumstances where there's high stress. So again, really changing your expectations, not about what a child's ultimately capable of, but what they're capable of, you know, in this moment, in this circumstance, and building on that.
Thank you so much. My child has learned how to speed, 5 years old, and now he wants to speed all the time, mostly when it's inappropriate. Any tips how to stop or change this behavior? Thank you.
Yeah, sure. So again, we can't stop or change a behavior till we understand why it's happening, right? And so hopefully these tools that I've provided in this discussion are going to be useful in terms of remembering to pause and try to evaluate and understand why a behavior is happening, because we truly can't change it until we understand what the function or the consequence of the behavior is, and then try to provide some type of positive alternative consequence, right? So again, it's hard to assess for an individual child, but it might be sometimes that things that look like a sensory maintained behavior actually serve a function of an attention or escape behavior. And so taking that observational data and thinking about the ABCs can really help provide insight on how to change the behavior and provide a functional alternative thing for the child to do.
Yep. I want to echo what Devon is saying, is that it's very hard to provide a specific recommendation regarding the specific child, because as you all know, when we do an evaluation, it takes 45 minutes to 1 hour, and to be able to provide a very informative answer based on one question or like 2 or 3 sentences is not ideal. So we're going to try to answer in general, and hopefully there will be information in the content that will be helpful to your specific situation.
I have one question. What is the best way to teach de-escalation strategy when child is overwhelmed? Telling to take a deep breath and counting to 10 doesn't help. It's Zayuda Mirzaitova.
I think a general consideration would be, I kind of equate this situation to athletes, right? Where they do a lot of practicing or drills before they're on the field or on the court, right? And sometimes we have the tendency to try to teach or prompt de-escalation strategies only when a child is really escalated, and that can be really difficult. So I would say, you know, trying to, it depends on the child, and it might be trial and error in terms of what strategy works well for him or her, but try to practice it outside of the high escalation situations. So identifying, you know, when frustration might be starting, or even discussing, you know, purposely pointing out small frustrations and practicing coping strategies during those times.
Thank you so much. I have another question. It's a Ukrainian questions. I'm sorry. She's asking a relocated child who adult autistic, he start cursing. The child is cursing and using bad words every time when some difficult situations is happening, and looks like he wants to get some attention. He cannot explain his behavior.
Yeah, again, I try so hard to put myself in that situation. So when we're under stress or change, you know, that's not very surprising. So I think the first thing is just acknowledging that the amount of stress this individual is experiencing. And then you said it seems like it might be for attention, but really evaluating the function of the behavior and then giving a functional replacement. So if it's that something is difficult, what we found to be really effective often is teaching kids or adults what to say to get the help that they need, instead of saying or doing the challenging behavior, right? Like even teaching, like, this is really hard. I need some help over here. I'm frustrated. And then providing that assistance contingent on that type of expression, but also giving people some, you know, grace and understanding of a stressful and a difficult situation.
In this situation, I think there was a mention that the swearing was in relationship to attention-seeking behavior. So if that is the context, I think the first thing about attention-seeking behavior, and Devon can correct me if I'm wrong here, is to try to ignore as much as possible. Now, it's very hard to ignore somebody swearing in a grocery store or on the bus or on in a public space, but that's where the focus should start. If this is related to an attention-seeking behavior, is to try to minimize the attention to negative behavior and try to focus on positive behavior and reinforcing positive behavior. And it's important sometimes, if a kid is verbal and can understand, is to revisit this topic with them at the end and stating that, you know, I ignored you when you were swearing because that's not a behavior that we support, and explain to them the strategy that you will be giving them attention when they are providing positive, when they are expressing or exhibiting positive behaviors.
And taking that ABC data, because if it seems like it could be a complicated situation if it's when things are difficult and for attention. So trying to observe what difficult things are coming and be proactive in giving the person alternative replacement behaviors for getting help or assistance.
Yeah, and in this situation, it's our reaction as parents is very critical, because we want to respond as calmly as possible by redirecting the child to more positive behavior and saying calmly, I hear that you are swearing right now, and that's not a behavior that is positive. Once you calm down, I will be able to attend your needs, whether you want to eat or you want to watch TV or play video game or go to somewhere. I will be able to respond better, and try as much as possible to ignore these behaviors and respond very quietly. It's going to be a little bit boring and repetitive for the child, but that's the best strategies to de-escalate the negative behavior and minimize the reinforcement for swearing.
We have like three questions who are speaking about same stuff. like tantrums in public places, child being aggressive towards people in a public places, and it's like the parents are trying to understand how this behavior was reinforced, why it's coming on. And this is like one of the questions which shows us in both in Ukrainian, English, and Russian speaking questions from the parents. Child is tantruming in public places and he's aggressive. I know it needs to be functional analysis, but I try to like speak about
I think
general topics.
Again, it's so easy to get caught up in why is this happening or what triggered it or how did they learn how to do this. But in a lot of ways, that's not the most effective use of our time, because what we need to understand is currently what's maintaining the behavior, right? So really understanding what is happening currently to have that behavior result in a positive consequence for the individual, doesn't mean for the adult, and then try to think of how you can not provide that positive consequence for the challenging behavior, prompt an alternative behavior, and provide a positive consequence. Like Dr. Hurden was saying, attention is really complex. And so there have been a couple of great studies that have looked at the fact that there are different types of attention. So there's proximity, how close you are to the child. There's a tone of voice. There is affect in your facial expression. There's physical touch, right? And then there's the words that you say. So neutralizing your attention in any of those ways while keeping a child safe is usually a good strategy for attention maintained behavior. But again, that's not going to be an effective strategy if attention isn't maintaining the behavior. So it sounds repetitive, but it's really important to understand the function.
Yeah. I'm mindful of the time, so maybe we should try to end. And I want to say something about the behaviors in public. Our kids are very observant. And they realize if they throw a tantrum in the house where no one is around, our response will be a little bit more appropriate, and we're gonna be able to implement, ignore the behavior very easily. But if they do it in a public place, more likely we're going to respond to their needs and give them whatever they want. So it's very basic, and kids pick up on that very easily. And that's what makes this process very difficult for us as parent and as a clinician making recommendation with regard to these. And sometimes you don't want a kid crying in the grocery store for 5, 10, 15 minutes. And maybe it's not the time where you enforce the rules, but that will serve as a reminder that it's to try very hard to try to reinforce the rules or the strategies that you like to implement in the home, where you have more control over the environment, or in the car, where you have more control over the environment. So just keep that in mind. It's very challenging, and there is no recipe that will say, okay, do A, B, C, D, E, and it will work. I think we've all worked with parents who dealt with these behaviors and with our kids, and sometimes we are not very successful. So on that, I think it will be good to end because we're running out of time. So that's an indicator. I think I see there are still a lot of questions. So Devon.
Yes, it's a lot of questions.
Yeah, Devon. So that means that we might want to see you again here. So maybe next time what we will do, it will be less lecture and maybe more questions. Trying to help guide the professionals and parents how to deal with these behaviors. So we'll come back to this topic hopefully sometime soon. And I want to thank Devon and everyone from the team who from the translator and Dana for taking the question, Irena, Dimitri, Daria, Christelle, and Beth, who has already left, attending to some other things. Thank you, and we will see you next time. Have a good rest of the day.
Bye.
Thank you. So